Marvin Plackett, and today is Wednesday, May 20th. Greetings to all residents, to all staff, and to all guests. First I want to say Molly is back. Welcome back, Molly. Molly works in the food service department at Episcopal Church Home. She was out for several days because she was in the presence of somebody who did test positive, and so out of an abundance of caution, she not only got tested, she stayed away for several days, which is a requirement, and she's back. Welcome back, Molly. Everybody loves Molly. Yesterday I reported that we currently have 16 COVID confirmations at Episcopal homes. We did have 17, you will recall, but the person that lives at Seabury, the resident at Seabury, has been removed from that list because the doctor cleared her 2 days ago. So congratulations, Irene. We're really pleased about that. And those 7 residents, so of those 16, 7 are residents. And of the 7 remaining residents with COVID-19, they are at Episcopal Church Home. They were in the Gilbert House, 3rd floor of Episcopal Church Home. They are now on 2nd floor in our dedicated COVID unit. And the balance of those 16, of course, are staff, and they are all quarantined and not scheduled to work, being paid to be home while they recover. So it would have been on Saturday that I informed you, and I think most of you got this message, but if you didn't, you're finding out for the first time anyway. On Saturday, I informed all residents, family members, and all staff that testing was occurring for Episcopal Church Home only, for all residents at Episcopal Church Home, and all staff that work at Episcopal Church Home was occurring on Monday. And that did occur as scheduled. On Monday morning, they were finished around noon. Again, I had mentioned to you that the National Guard, they were the ones that conducted this test, and they were very professional and conducted themselves properly, as one would hope. We received word yesterday morning, extremely disappointing news, that all the test samples had to be discarded. And I'm going to right now read to you a letter that I sent. No, I didn't actually send it. This letter is from Melissa, and it was sent to all Episcopal Church Home residents and their family members. I sent a very similar but more detailed letter to all staff yesterday. This letter is from Melissa Schneider, the administrator of Episcopal Church Home. I'm going to read that to you. To all ECH residents and family members, subject is testing update. You are aware that all residents and all staff at Episcopal Church Home were tested yesterday for COVID-19. We were just informed this morning by Mayo Clinic, and again, that was yesterday morning. We were informed by Mayo Clinic, the lab that was assigned to all of our test kits, that all the test samples were compromised due to the timing and the way they were transported to Mayo Clinic by the Minnesota Department of Health. All samples had to be discarded because they were incorrectly exposed to excessive heat. Inez and I and the entire leadership team at Episcopal Church Home cannot tell you how saddened and angered we are that this major mishap occurred, even though it was through no fault of our own. We feel so badly for all that endured this test and are awaiting test results. Some expressed the pain felt with the administration of these tests. We know. We experienced the same discomfort. We feel your disappointment. We feel your frustration. We too are angry that this happened. At this time, we are aggressively working to inform the highest levels of state government our anger and frustration. They need to change their systems promptly so that they never make this major mistake at other facilities. The manager for the statewide healthcare coordination center already reached out to us and said, quote, "We failed you and your residents, and for that I am deeply apologetic. We have changed our systems and approach and learned from this tragedy, but I am sorry that all I have is our sincere apologies to offer in return for this situation," end quote. I have not yet concluded how we will proceed with future testing efforts. We will update you as soon as we know. In the meantime, we will prioritize whatever tests we are able to conduct on a daily basis to those displaying any of the symptoms or those that may have been exposed in some way, our first priority is to keep everyone safe and healthy. We will be back in touch with you as soon as we have updates. Please reach out to me if you have questions. Sincerely, Melissa. And to let you know that Jan Malcolm, the Commissioner of Health, she reached out to me today. It was this morning. Yesterday, the person that was coordinating this effort reached out to us, expressed sincere apologies for these mistakes that were made, and they explained that systems have already been implemented to ensure that this doesn't happen again. So thank you, Commissioner Malcolm. We appreciate that. But I wanted all of you to be aware of this, what had unfolded. So in terms of retesting, we know we are going to retest everyone at Episcopal Church Home, all residents, all staff. We just don't know yet when, and we don't yet know through what organization we're going to be working, if it's going to be our Health East partner or not. We will see. To let you know that the Center for Medicare and Medicaid Services, and they are the national organization that is over all nursing homes, that they put out an update just, I think it was yesterday, talking about how nursing homes might, quote unquote, open up. As you know, most of the states at some level are opening their society back up, and that includes Minnesota to a very limited degree, of course. Well, at some point, nursing homes are going to open up as well. Now, the CMS, Center for Medicare and Medicaid, they are turning over the details of that quote-unquote opening up of nursing homes to the state departments of health. And so until we get more information from the Department of Health, we really don't know for sure how that's going to unfold, but I don't expect any changes anytime soon. And of course, we have, at Episcopal Homes, we have the 16 active cases right now. And like I said, I don't expect any changes anytime soon for at least the foreseeable future. When I say that, I mean for at least the next few weeks. And I will absolutely give you updates just as soon as we have any updates on that front. A reminder that the basics are what keep you safe and your loved ones safe, your neighbors safe. It's vital for all of us, all residents, all staff, all guests, everyone in society, that we practice those basics that really at this point is our only vaccine. And it's not 100% guaranteed, just like a vaccine isn't 100% guaranteed. But it goes a long way to preventing the spread. And those basics are, once again, to staff. If they have any symptoms, they don't even show up. Don't even show up for your shift. Stay home, call your healthcare provider, inform us, and then if necessary, you get tested if the symptoms are there. And then when any staff come to Episcopal Homes to start their shift, they go through a rigorous screening before every shift. And if they don't pass that screening, then they're not scheduled to work that day. Then the other basics of wearing a mask anytime you're not in your apartments or in your rooms. Be sure to keep that 6-foot social distance. Very important. Stay within your community, stay within your zones. So, frequent hand washing. And as I've mentioned several days now in a row, all these things added together, that's what prevents the spread. Any one of them alone doesn't. But you add them all up, implement them all, follow all these things, and that's what prevents the spread. In today's Star Tribune, there's an article, the lead article, titled, Minnesota Nursing Homes, already the site of 81% of COVID-19 deaths, continue taking in infected patients. I just want you to know what our policy is here at Episcopal Homes. So once again, we have 2 nursing homes at Episcopal Homes. We have Episcopal Church Home, and we have the Gardens. And we are not accepting any, quote-unquote, outside COVID-19 positive patients or residents. So if a hospital calls and tells us that they have someone that they would like to send to us, but if they test positive for COVID-19, we are not accepting them. Same thing with any transfers from any other nursing home or any other organization. The only residents that are here at Episcopal Homes are ones that have been with us for some time. They already have been residents of Episcopal Homes in one form or another. And if someone at Episcopal Homes has COVID-19 and becomes ill enough that they are transferred to the hospital, because that has happened in one case already, if they are transferred to the hospital and then once they recover to the degree that they can be discharged from the hospital and then they are sent back here, yes, definitely we accept back the residents from the hospital that have already been on our campus. So that is the only way that we accept a person who is currently active with a COVID-19 case. So I felt that was very important for you to know that, especially in light of the fact that you may well have read this article in the Star Tribune today, and you may have wondered, what is our policy? So now you know, all right? Remember, if you need to reach me, don't hesitate to reach out, mplackett@episcopalhomes.org. Be well, everyone. I look forward to seeing you tomorrow at 1:30. Take care.